Hello everyone, welcome to PSC Mantra. July 13 നടന്ന ലാബ് അസിസ്റ്റന്റ് MLT Biochemistry Microbiology question paper ആണ് നമ്മൾ ഇന്ന് നോക്കാൻ പോകുന്നത്. അപ്പോൾ നമുക്ക് ഫസ്റ്റ് ക്വസ്റ്റ്യനിലേക്ക് പോകാം. Question number 1. The following is not true about deionized water. താഴെ കൊടുത്തിരിക്കുന്നവയിൽ deionized waterനെ സംബന്ധിച്ചല്ലാത്തത്. Option A, high purity than distilled water. Option B, neutral pH. Option C, high electrical conductivity. Option D, need not be sterile. The correct answer is option C, high electrical conductivity. Next question. The cleaning of culture plates after use include the following steps in order. Rinse thoroughly with the tap water. Autoclaving 30 minutes at 121 degrees Celsius. Brush with the detergent and water. Dry. Pour out the contents of media. Rinse with the distilled water. And the correct answer is option C. That is, rinse thoroughly with the tap water. Autoclaving 30 minutes at 121 degrees Celsius. Pour out the contents of media, brush with the detergent and water, then rinse with the distilled water, dry. Question number 3. The main responsibilities of laboratory professional include all except. Laboratory professional responsibilities in allathadedu. The correct answer is give medical advice and necessary medical treatment to patients. Question number 4. First aid for minor burns don't include. Option A, protect area with a sterile, non-adhesive bandage. Option B, apply ice or butter. Option C, don't break blisters. Option D, take a counter pain reliever. And the correct answer is apply ice or butter. Question number 5. The optical path within cuvette is always. Option A, 10 mm. Option B, 1 mm. Option C, 1 cm. Option D, both A and C. And the correct answer is option D, both A and C. That is 10 mm and 1 cm. Question number 6. Insoluble solid can be removed from a liquid by option A, analysis. Option B, filtration. Option C, distillation. Option D, titration. And the correct answer is option B, filtration. Question number 7. Find the correct pair regarding color code for biomedical waste collection bag. Black body parts, red contaminated plastic, white sharps, yellow placenta. And the correct answer is option C. That is red contaminated plastic, white sharps. Find the carcinogenic chemical. Option A, selenite. Option B, nitrosamine. Option C, benzidine. Option D, all of the above. And the answer is all of the above. Question number 9. Most common causes of electrical hazard the laboratory staff should be aware of is. Option A, long flexible electrical connecting cables. Option B, electrical equipment left switched off. Option C, cables are insulated. Option D, electrical cords are as short as possible. And the answer is option A, long flexible electrical connecting cables. Question number 10. Reagents with accurate concentrations can be made using. Option A, Erlenmeyer flask. Option B, conical flask. Option C, volumetric flask. Option D, round bottomed flask. And the answer is option C, volumetric flask. Question number 11. Which condition may be indicated by an increased reticulocyte count? Option A, hemolytic anemia. Option B, aplastic anemia. Option C, pernicious anemia. Option D, iron deficiency anemia. Correct answer is option A, hemolytic anemia. Question number 12. In which all hypersensitivity reaction do eosinophilia is seen? And the correct answer is option D, type 1 and type 4 hypersensitivity reaction. Question number 13. Which of the following is true with the Bombay blood group? Option A, H gene is present. Option B, H gene is absent. Option C, H substance is formed. Option D, seen in subgroups of A blood group. And the correct answer is option B, H gene is absent. Question number 14. A negative result in the indirect Combs test suggests. Option A, the presence of antigens on red blood cells. Option B, the presence of antibodies in the recipient's serum. Option C, the absence of antibodies in the recipient's serum. Option D, the absence of antigens on red blood cells. The correct answer is option C, the absence of antibodies in the recipient's serum. Question number 15. Both the naturally occurring and immune antibodies may or may not bind complement. All the main blood group antibodies bind complement except option A, Rh antibodies. Option B, anti-A. Option C, anti-B. Option D, both the anti-A and anti-B. And the answer is option A, Rh antibodies. Question number 16. Name the coagulation test which is prolonged in a patient with hemophilia. Option A, D-dimer test. Option B, thrombin time. Option C, prothrombin time. Option D, activated partial thromboplastin time. And the answer is option D, activated partial thromboplastin time. Question number 17. Westergren's method is used to find erythrocyte sedimentation rate. The working distance of the Westergren's tube used in this test is option A 100 mm, option B 150 mm, option C 200 mm, option D 250 mm. And the answer is option B 150 mm. Question number 18. The Bluetooth vacutainer tube contains which anticoagulant? Option A sodium fluoride, option B sodium citrate, option C heparin, option D EDTA. And the correct answer is option B sodium citrate. Question number 19. Drapkin's reagent is used for hemoglobin estimation. It contains. The answer is option A sodium ferricyanide, sodium dihydrogen phosphate, potassium cyanide. Question number 20. Internal diameter of a capillary hematocrit tube is option A 1 cm, option B 0.1 mm, option C 0.2 mm, option D 1 mm. And the answer is option C 0.2 mm. Thanks for watching. Channel ആദ്യമായിട്ടാണ് കാണുന്നതെങ്കിൽ സബ്സ്ക്രൈബ് ചെയ്ത് സപ്പോർട്ട് ചെയ്യുക. Thank you.